Alberta does not have a healthcare system so much as it has a sick care system. That is according to Brianne Roberge. She is a registered nurse, holistic health coach, and the founder of the Holistic RN and Company, which is based in Stony Plain, Alberta. She joins us now via Zoom to talk more about alternative approaches to taking care of our health and how her company helps others to do so. Brianne, welcome to Bridge City News.
Thank you so much for having me.
So, Brianne, tell us, why did you start the Holistic RN and Company, and what kind of need were you seeing?
Thank you so much. So, the Holistic Art and Company was actually born about 60 years ago, and it actually started under a different name at the time, and it was just me on the company itself. And this actually ended up happening after I experienced my own health crisis and felt that I wasn't being as supported from our Western medicine practitioners as I had hoped. Now, I had actually just completed nursing school and was actually working in bedside nursing myself at the time. And I had been going from doctor's appointment to doctor's appointment, trying to get answers in regards to the symptoms that I was experiencing. And unfortunately, it took quite a few years before I actually ended up being diagnosed with what ended up being celiac disease. Now, this kind of sparked an interest in terms of nutrition and understanding what exactly the body ends up doing with the food that we bring in. And from that, I ended up enrolling in multiple courses, certifications, and trying to understand this holistic side or this nutrition side a little bit deeper. And in regards to that, I really started to explore how much of an impact different things that we do can actually result in other health crises later on. And in terms of nutrition, just to give you a little bit of an insight, in our 4 years of a nursing degree, or at least in my education, I only received a half an hour on what nutrition was. It taught me what
Oh,
a protein
wow.
was, a carb was, a fat was, and that was it. So there really isn't much education that's provided in our actual degrees in regards to how much this can impact the body. Moving forward over the years, I started to realize that Western medicine and what we are trying to achieve is unfortunately putting a band aid approach on a lot of what we're doing. And we're trying to heal individuals by fixing the symptom and not actually fixing the root cause of that problem itself. So, over the years, I've been working really hard to help individuals and clients come through who are seeking alternative therapies or alternative ways of looking at their health and actually healing that root cause and figuring out what is behind that illness or that condition or that disease that they are presented with, and helping them actually resolve that or at least reduce that to the point where they're able to live a normal life without a prescription medication.
So when we talk about the spectrum of Western medicine and holistic medicine, are the services and advice your company offers intended to be a supplement to modern medicine or an alternative to it?
Great question. So, this is actually one of my favorites to answer. So, just to give you a little bit of perspective, right now we kind of have Western medicine on one end of the spectrum. And we have a lot of practitioners there that are fantastic at what they do. They're able to, really have some innovative means behind figuring out what's going on with specific individuals. And on the other end of the spectrum, we have all of our holistic practitioners, and they are fantastic at being able to heal the body in a natural way. But right now, on both ends of the spectrum that are very far apart, there's currently nothing that really exists in the middle. And clients and patients are both feeling like they need to invest in all or nothing. So they have to be all in holistic medicine or they have to be all in Western medicine. And they don't really understand that you can have a blend of both of those worlds. Now, when we're talking about Western medicine, I mean, myself and the other nurses on our team by no means think that Western medicine is an issue. Western medicine is innovative and amazing and definitely helps save lives. I mean, if we get in a car accident or have a heart attack or cut our arm off, we're not going to rub some herbs on it and hope that it heals. We definitely need Western medicine in these times. But with that being said, we are taking too much of a reactive approach to health, and we need to turn towards more preventative, holistic means to be able to help individuals both avoid disease and then when it's presented, be able to heal in that means as well. So, our company behind what we offer in terms of our services and our programs and working with clients is very much a customized approach. We help individuals bridge the gap between holistic medicine and Western medicine, bring those two things together and figure out how they can manage their disease in a way that makes the most sense for them, being able to reduce or eliminate those symptoms and ultimately live that better quality of life to the best of their ability.
Now, you said you started your company 6 years ago. That's before the pandemic. So did you notice a surge in business when COVID cases were on the rise? And what kinds of questions were your clients asking?
Absolutely. So I did start the company about 6 years ago, and it actually ended up about 3 years ago being rebranded under the Holistic RN, and then now the Holistic RN and Company as I've started to add more nurses to my team. So I officially hung up my scrubs in the hospital just before the pandemic hit 3 years ago. And as we moved into the last couple of years, and of course the unfortunate circumstances that we've all had to face, I wouldn't necessarily say that the surge in clientele that we've been seeing has been related to the high COVID cases, but more so that they are recognizing the impact of burnout of our frontline workers. They are going in for a doctor's appointment where they are only being seen for 5 minutes. Their concerns are not being seen or heard. They are being passed a prescription and walked right back out the door with none of what they're hoping to be, discussed or have their questions answered actually coming to the table. So, in terms of the questions over the last couple of years, I would say it's more so been about how can they help their bodies in that natural way to be able to support their own system, their own immunity, and things like that as well. I mean, when we're talking about the immune system, 75% of our immune system is actually in our gut. So, when we're talking about the importance of nutrition and eating whole foods and eating foods that our bodies specifically agree with, that is astronomically important. So, it comes back to those questions being more so about that health variant and being able to approach this in the most natural way possible and what they can do for their own immunity.
So, as someone who is on the center of this really broad spectrum, which seems about as broad as like the political spectrum, what advice have you been giving to those who have been hesitant about getting a COVID-19 vaccine or maybe unsure whether they should get a booster?
Great question. So I will be honest, we are not advising, coercing, or pressuring anybody into making a decision one way or the other. Our company very much stands behind the ability for individuals to choose what makes the most sense for them and be able to advocate for that decision. So we're all about providing education and information, both on, the vaccine itself in terms of what are some of the potential benefits that they could see? What are some of the potential side effects? A big thing that's been missed over the last couple of years, and also educating on natural immunity and what their body can do. So we provide all of the information and then we help them make that decision for themselves and feel supported in that decision. So regardless of what end of the spectrum individuals fall on, they can feel supported and heard from our company specifically.
And many people just have so many different thoughts on nutrition and healthcare and doctors and pharmaceuticals. How do you help individuals that are just overwhelmed with the abundance of and often confusing information out there?
It's a great question as well. So you're absolutely right. It is super confusing. And, if you were to Google anything out there and say, why is this harmful or why is this beneficial, you would absolutely find a million answers to support that question. I mean,
Hmm.
take dairy, for instance, a super controversial one that is so much,
Yeah.
red flags on either end of that.
Hmm.
So, for instance, in regards to nutrition specifically, I mean, the body is so unique. We are built very differently. What works specifically for you and your body is not necessarily going to work for me and mine, and vice versa. And so, looking at each individual and figuring out what works specifically for them is a process called bioindividuality. Now, our company strongly believes that, there is no right or wrong way to do anything. And when we're looking at each individual client, we're figuring out what works specifically for them and their body. So it's not about what's right and what's wrong, but more so what works for them, what feels the best to them in their life, and what does their body actually agree with. So there is a bunch of experimentation and, trial and error in that process of working with your practitioner to figure out what actually makes sense for you. But it's navigating that confusing information to know that there really is no right or wrong answer, but more so what it comes down to for you in your life.
Now, the past several months, Canadians have seen inflation hit record levels in recent years, and some have taken second and third jobs. Others are skipping meals in order to keep their heads afloat financially. And on top of all that extra work, stress is likely taking a toll on all of us. So, what are some ways that we can stay healthy and balanced while keeping up with the runaway costs of living?
It's a great question. So, in regards to this, I mean, economy wise, there's not a whole bunch that we can do to get away from the current circumstances that are available to each individual. And stress is astronomical when it comes to the impact on our health itself. Our cortisol levels, which is our stress hormone, as soon as those begin to rise, the implications in the rest of our system definitely are impacted directly by that. I mean, every single system in our body is interconnected. So when we're talking about what individuals can do to be able to manage that stress and the rising costs and still take care of themselves, I always recommend starting slow and doing something, to focus on and prioritize themselves every single day. So when we're talking about making steps and making changes, if you wanted to be able to improve, say, the food that you're eating to improve the health of your body, I would not recommend you go to your pantry, toss out all the food, and buy everything fresh to start tomorrow. Instead, I recommend adopting the mentality and the idea of using something up and replacing it with a better option. Whether we're talking about our food supply, we're talking about, beauty products, household products, or anything else that we want to start moving towards a more natural means of living and having in our own lives, using something up and replacing it with a better option is a slow approach. It's not so overwhelming, it's not so stressful, and it definitely is more financially supportive and doesn't create so much of an overwhelm in that sense.
Now, here in southern Alberta, the city of Medicine Hat during the pandemic, they weren't hit by the pandemic so much as they were hit with a plague of male suicides. And so I want to talk about mental health for a bit because we touched on it just a bit. Now, I've read that there's a link between mental health and gut health. Can you talk about that?
Absolutely. So I like to call our gut our second brain. And our gut has a huge impact in every single system, every single organ. And what we eat and ingest absolutely has an impact on our mental health. In fact, 95% of our serotonin, which is our happy hormone, is actually made in our gut, which a lot of people don't realize or understand.
Wow.
So when we start looking at the food that's coming in and we talk about, the convenience food that a lot of us tend to reach towards in terms of the things that come in a bag or box and have more than one ingredient, those things are often filled with refined or processed ingredients that definitely aren't supportive to our best mental health. And when we take in these foods often and regularly, our body has a hard time keeping up with those toxins, can build a lot of inflammation, and over time ends up ultimately creating havoc in other systems, including our brain. Absolutely. So, when we're talking about being able to improve that, one of the best things that you can do is being able to do some intolerance testing or sensitivity testing, figuring out specifically what your body is saying yes to or no to, and then also being able to move towards eating more natural whole foods to the best of your ability as well. So you can reduce that inflammation and improve your body's system automatically.
Now, you said earlier that everything in our lives and in our bodies is interconnected. So we could eat healthy, we could drink plenty of water, exercise daily, but we could still run into health problems if we're not looking after another area of our lives. For example, we could be doing all that, but maybe we're not getting enough sleep or not setting time aside to relax. So, Brianne, what is the number one thing that you have noticed Albertans are lacking in?
Oh, I don't know if I can pinpoint it honestly, because like I said, it comes down to each individual in terms of what their specific life is saying yes and no to. But we do have a concept called primary food that we like to focus on. And it's not actually the nutrition that's on your plate. And primary food actually references your lifestyle. So this actually incorporates 12 different areas, things like your spirituality, relationships, career, finances, home environment, all of those things. And I typically tend to find that most of the issues that individuals are facing actually come from the primary food category and not from the nutrition or other pieces of their lives. And this is because we can eat as healthy as we want to, but if we're in a toxic relationship or a career we hate, ultimately we're still going to be open to the possibility of disease or other, unhealthy pieces of habits or whatever that might be.
Now, we're almost out of time, but I want to squeeze in one more question for you because there are a lot of people, especially children, dealing with colds and flu bugs right now. And then supply issues with children's medications are causing emergency rooms at hospitals to fill up. What is your holistic recommendation to help both children and adults handle the flu season?
Absolutely. So I definitely recommend if you have the ability to book an appointment because as far as medical advice goes, we want to make sure that we're not providing any, general recommendations to the public and more so that they are able to get specified advice based on their own lives, conditions and concerns and things like that. However, some of the things that I recommend looking into are things like daily movement, being able to get outside and get lots of adequate vitamin D levels. And if not, perhaps supplementation might be a good idea for you. Being able to pay attention to vitamins that your body needs, paying attention to that nutrition category, and doing your best to eat whole foods and enough of them so you get enough nutrients for your system specifically. Staying well hydrated, and even looking into some natural herbs as well that might be able to support your body in whatever prevention technique you might require.
And you recently announced that your company is expanding and you're looking to actually hire 10 more registered nurses. And How can those in southern Alberta get in contact with your company? Are there staff in this neck of the woods?
Absolutely. So we're not just actually hiring registered nurses, but we're also hiring licensed practical nurses as well. So our goal is to expand our team by 10. We're actually in the midst of completing over 70 interviews at this time. Our current clinic is in Stony Plain, and we do have the, I guess you can say, focus and hope and desire to open 4 more clinics across Alberta next year, or this year, I guess I should say. So we're looking at Edmonton, Red Deer, Calgary, and Lethbridge for being our potential clinic spaces that are will be opening. And it will just be dependent on our team members who actually end up coming through what those spaces will look like and where exactly they will be located in every city. But if they want to head to our website, theholisticrin.ca, they'll be able to follow our journey, join our mailing list, and get in contact with us and know when those other clinic spaces are going to be open and when those team members will be able to provide those services.
Well, that's excellent to hear. But that's all the time we have for today, Brianne. We really appreciate having you on our show.
Thank you so much. I appreciate being here.
Brianne Roberge is a registered nurse, holistic health coach, blogger, recipe creator, and the founder of the Holistic RN and Company.